What if you could diagnose your own self through several different health markers on the outside of your body to understand what is happening underneath? Welcome to this deep dive of doctoring yourself from your face, your eyes, your tongue, your gut health, all the way down to signs on your feet and ankles and what they might correlate to inside the body. If you're new to this channel, my name is Troy Rice. I'm an integrative medicine practitioner and naturopath, trained in several different disciplines, including brain health, functional breathing, and integrative medicine. So I'm excited to offer you this free training on diagnosing yourself so you know what the next steps might be if you are starting to see issues or problems, okay? So let's go ahead and get started. So here we go. So in this learning, what we really want to do is figure out what is showing up externally in the skin and your eyes and your mouth, even on your feet and ankles, that is an indication of poor health signs internally. So basically, the inside of you is actually telling a story and it's showing up on the outside of you. And these are some things that you can pay attention to, think through, and then work with, if you have a trusted doctor or a practitioner like myself, to build a plan that is correlated to these signs and symptoms, especially if you're somebody that's not considering any type of testing. So here we go. Let's start with the eyes, all right? 8 indicators of poor eye health and things that you should pay attention to. Here we go. Number 1, conjunctivitis, okay? Inflammation of the outer eye or pink eye. Hemorrhage is something to pay attention to. Dry eyes. And so some of these things that we're going to cover throughout the training today could be things that you notice and then you overlook it, right? And then maybe the next day you do notice it a little bit, but then you just kind of go throughout your day. It becomes our new normal, right? But it shouldn't be the new normal because these are signs. These are indicator signs. And if you believe in the Ayurvedic principle method, there's 6 stages of disease, right? Which these signs start to show up and then they kind of grow within the body and then it gets to a dis-ease state in the body. And you don't want to be in that dis-ease state, okay? So what are the next ones? Light sensitivity, okay? Vascular keratitis, which is inflammation of the cornea. Night blindness. Uveitis, which is caused from like blue light, poor sleep, allergies, TH imbalances in the body. And then tetany. I don't know if you've ever had this. I get this a lot, especially when I go on like trips or vacations and maybe I'm experiencing like low sleep, maybe heightened stress. I start to see this little twitch, right, of the eyes. That's called tetany. A lot of times, many of these things we're talking about right here around eye health are related to vitamin B deficiencies, okay, or mineral imbalances. So certain things, obviously like better sleep and stress management, but other things that might help are paying attention to your minerals like magnesium, sodium, potassium, okay? And then your B vitamins like vitamin B12, B5, B6, okay, B2. And so a lot of those things, and those are the things that we kind of help you customize a plan for if you are having these signs. But let's keep going, all right? How about your face, all right? So here are 5 warning signs that actually might present as circulatory issues, cardiovascular issues, inflammation or blockage of the arteries, and then potentially cholesterol or plaque buildup as well. So number 1, skin on the nose is a different color. So if you're outside playing in the snow or you live in cold weather, that's not what we're talking about, right? But if on a frequent basis, the tip of your nose is a red or bluish tint all the time, that's usually a sign of one of these types of warning signs, cardiovascular health, circulatory issues, okay? Sometimes the tip of the nose is even hard. Like if you push on your nose and it feels soft, great. If you push on it and it feels really hard, that's also a sign that there might be something else going on, okay? The tongue. So if you were to lift your tongue up and you had black veins underneath your tongue, and I'm not blue, like a bluish tint is totally fine, okay? We're looking for like dark blue or black. It's usually a sign of some problems, okay? A diagonal earlobe crease, which is called Frank's sign. It's actually indicated in this free guide I'm going to give you, but it's a little crease right here has also been correlated to cardiovascular problems and circulatory issues, all right? Puffy eyes. And again, not from a few days of lack of sleep, which then you should improve your sleep, right? But constant puffing of the eyes, especially in and around the eyes. And I've even had clients that have had puffiness not just below, but above the eyes. Like, pay attention to that too, because your body works in various different ways, but puffiness around the eyes at all is usually a sign of that. And then a gray ring around the iris. So if you look really close in the mirror and you were to see a gray ring around your iris, that might be an indication of poor circular health as well, or blocked arteries or cardiovascular problems. So check out those on your face, okay? The tongue. This part is very fascinating. If you are new to learning about tongue health and all that, you can diagnose your health of your tongue because your tongue is the top of your digestive system. So we're going to walk through exactly what that means. So let me give you a scenario, okay? And so in a perfect world, you want the tongue to present as nice, smooth, pink, maybe a thin coating of saliva, right? But if you think about it, your tongue is at the top of your digestive system. So from the back of your tongue to the tip represents all the components of the body, okay? So the back of the tongue represents your rectum area to the top of the tongue, which is the neck and the brain. So the middle of the tongue represents the small intestines, right? Think about that. Transverse colon, pancreas, stomach, heart, as you kind of go down through the tongue. And then you can correlate like your gallbladder and your liver, okay? So the right side correlates with your gallbladder and the liver, and then the left side represents the spleen, okay? And just remember, like when you're looking in the mirror and you're to stick your tongue out, right, you're seeing yourself backwards. So pay attention to that. When I talk about the directions, it's the opposite because you're looking in the mirror. So what are the signs telling you, right? Dark purple on the bottom of the tongue is weak digestion or malabsorption problems. Teeth mark indents means weak digestion or malabsorption problems. Swollen or thick tongue is a sign of congestion, maybe lymphatic congestion, mucus in the body, or even bloating. Yellow tint on the right side would be correlated with liver health or poor liver health, right? Hot spot near the tip is going to be your thyroid health. White bubbles on the sides of the tongue could be bronchitis. White coating towards the back of the tongue, sometimes referred to as thrush, is usually candida or bacterial overgrowth, okay? And then the last one, rash on the tongue, is correlated to yeast, fungal-based markers, and potentially poor gut health. So isn't this fascinating? All right, let's talk about the gut, all right? Maybe many of you have heard of leaky gut syndrome, right? A permeable gut. Let's talk a little bit about that, but then let's talk about 12 signs of leaky gut. Okay, here we go. Certain triggers can cause intestinal wall damage and tight junctions of the intestinal wall to become permeable. That's leaky gut. This leads to pathogens, yeast, fungal, food particles, excessive protein particles, bacteria, and toxins, and then they all get released in the bloodstream. Think about it. In a perfect world, you eat food, it goes down your esophagus into your stomach, it breaks down the particles, and what goes through your intestines and your colon are the food particles. Everything else that's extracted, like your vitamins and your minerals and your antioxidants and all that, goes into the bloodstream to help you function. But if you have a leaky gut, you're also leaking in all those other things. And it can cause problems for absorption, right? Because your body's trying to focus on getting rid of all these pathogens in the body. So what causes that? And then we'll talk about some signs and symptoms. So some triggers: infections, blood sugar issues, pregnancy, high stress, menopause, toxins, food allergies, gluten, dairy, inflammatory and sensitive foods. NSAIDs like Motrin and Tylenol can cause problems for leaky gut. Alcohol, birth control, and halogens like chlorine and fluoride. So what are 12 signs? Fatigue, okay, muscle and joint pain, skin rashes, and we're going to talk about skin in a little bit, mood disorders, learning disorders, autoimmune issues, headaches, migraines, brain fog, sleep apnea and snoring, acid reflux, weight gain, and food craving. So if you have any of those 12 signs, it could be a sign of leaky gut. At the end of all these trainings, I always have a link to functional medicine testing. If you really want to see what your gut health looks like, I would encourage you to check that out, okay? Let's talk about the skin. 7 important skin warning signs of diabetes or prediabetes. and then 10 signs of histamine intolerance, because they're kind of they're very correlated, okay? And a lot of times we hear about histamines or histamine blockers. Maybe if you grew up with allergies, like personally, like I had a lot of allergies when I was a kid. Like I had itchy eyes, watering eyes, sneezing constantly, especially around the summer months. And I reversed all of that when I started to learn about all this, because it's really about rebalancing your gut and your histamines in the body, which are absolutely needed to fight off different responses, okay? So 7 signs for diabetes and prediabetes, all right? Dark patch of velvety skin, typically on the back of the neck, the armpit or groin. Hard, thick skin, especially on the knuckles and the toes. Boils and cysts, itchy, dry rashes, bed sores or ulcers, okay? Skin tags, all right? Red, brown spots on the lower leg as well. And then let's talk about 10 histamine intolerances. Basically, you have an overreactive histamine response to anything. Compounds coming in like food in the body, toxins in the environment and the air, maybe even chemicals and products that you use, or your shampoo or your water or your shower water, okay? So here are some signs. Headaches, migraines, clogged sinuses, diarrhea, asthma, palpitations, red skin spots, okay? Hives, vertigo. I can't tell you how many times that I've had clients that come in with problems of vertigo, and really all we do is we help them heal the gut and rebalance histamines, and their vertigo goes away. It's amazing. And then low blood pressure as well is also a sign, okay? Feet and ankles. So here we go. 8 signs your feet might be telling you about your liver health. Let's see here. Liver health problems often are correlated to what is being presented on the feet and ankles. It's so true. I don't know if you heard about the liver-foot connection. I've done a few videos on this, so I'd encourage you to check those out. But basically, it's attributable to many factors, including nutritional deficiencies, toxin buildup, fat buildup, excessive sugar, ultra-processed foods, excessive protein intake, and even certain medications can cause problems with your liver. And then it shows up in the feet and ankles. And so here we go, 8 signs of that, all right? Pitting edema could be related to your liver health. Red or brown spots around the ankles could be poor circulation, also correlated with liver health. Spider veins could be not only liver health, but too much estrogen in the body. Cracked heels could be a vitamin B3 and omega-3 deficiency, potentially low bile too. Maybe you're having issues with your liver making bile and storing it in the gallbladder. Maybe you don't have a gallbladder anymore or was removed. So that could be signs. You don't think there's things that you can do to rebalance that. Itching on the bottom of the feet is usually a congested liver. Pain on the bottom of the feet or mimicking plantar fasciitis, also a sign of poor liver health. Hot feet or bad odor are signs of detox issues related to your liver. And then fungus under the nail is a sign of poor liver health and gut dysbiosis as well, okay? So all of that said, which are amazing, right? We just talked about the head all the way down to your feet that you could do on a daily basis just to check in with yourself, okay? But what can you do about it? So what we often talk about is let's build your personalized wellness suit. And so how we do that with clients is we help them build foundational lifestyle factors around diet, exercise, stress, toxins, recovery, emotional health, sleep health, and then supplements when needed to rebalance the body, because we believe that you should be able to live in your suit of wellness the rest of your life, not chase it, not chase a weight loss goal, chase, reversing autoimmune issues or whatever it is, being on a life of medication. You don't deserve that, right? You deserve a life full of health and well-being. And so we go through this phase where we define the current state of you and your current wellness suit, and then we help you build a lifestyle foundation of the wellness suit that you love to live in and that loves you back. So hope you enjoyed this training on diagnosing yourself or doctoring yourself per se. Please access the free training guide at the bottom of this with all the details that we talked about, including additional links for building your wellness suit. There's also a de-stress guide, reversing chronic stress guide in there. There's a community you can join, and then, of course, how you can get started with building a precision protocol to helping with any signs or symptoms that you find out from what we discussed today. So thanks for joining me, and I will see you next time.